Hello everyone, my name is Atul Ghodvinde and my coordinator names are Rohan, Gharat, Hemant, Fulore and Rushikesh Gole. We are studying in final year B Pharmacy from Shivajirao S. Jondhle College of Pharmacy. Today I am going to explain sterile dosage form, that is Parental, guided by Nitin Moire, professor and principal of our college. Introduction. Parental refers to the injectable route of administration. It is derived from Greek word para means outside and enteron is intestine. Parental dosage form differ from all other drug dosage form because they are injectable directly into body tissue through the skin and mucous membrane. They are packed in single dose units and multiple dose unit. In single dose unit, ampoules, infusions, pre-filled disposable syringe, and multiple dose unit, multiple dose vials. Classification of parental product on the basis of production volume, that is small volume parental and large volume parental. Small volume parentals are sterile pyrogen free injectable products that are packed in volume up to 100 ml, and large volume parentals are sterile pyrogen free injectable products that are packed in volume more than 100 ml. The small volume parentals are given by route intravenous, intramuscular and subcutaneous. The large volume parentals are given by intravenous route. Small volume parentals contain necessary the medicament which is potent. Large volume parental contains one or more electrolytes and supply nutrients such as vitamins and glucose. The dosage unit of small volume parental is single or multiple unit, and large volume parental is single unit dosage form. Preservatives are used in small volume parental and not used in large volume parentals. The small volume parentals are usually packed in vials, ampoules of small sizes. Large volume parentals are packed in the large container, glass or plastic up to 1 liter capacity. Small volume parental drugs such as suspension, emulsion and freeze-dried product. Large volume parentals include saline solution, dextrose and ringer solution. Small volume parentals are used as therapeutic agent. Large volume parentals are used as nutrition and detoxification. Ideal properties of parental products involves various considerations. First is sterility. Sterile preparation should be free from all types of microorganisms. Parental product must pass the sterility test. Isotonicity. Parental preparation should be isotonic with blood plasma and body fluids, free from pyrogens. Sterile formulation must be free from pyrogen and toxins. Thus product must pass the pyrogen test as the pyrogen are responsible to rise the body temperature. Fourth, free from foreign particles. Thus product must be free from foreign particles, dust, fibers and must pass the clarity test. Stability. Physical and chemical stability of sterile formulation should be maintained during the storage. Types of parental preparations. First, infusion fluid. Parental solution which are administered by the intravenous route, generally used for nutrition, restoration of electrolyte balance. Thus are available in single dose container. Example, sodium chloride injection, Ringer's injection, dextrose injection. Second, solution or emulsion of medicament for injections. They are commonly used as injection and available in single dose container or multiple dose container. Example, diclofenac sodium, dexamethasone. Sterile solids. Thus drugs are supplied as the dry sterile solids which are dissolved in suitable solvents for administered into the body. Thus are available in dry solid because the drugs are not stable in solution form. Example, benzyl penicillin G sodium injection. Fourth, sterile suspension. It is a sterile suspension of drug in a suitable solvent and administered by the intramuscular route. Example, hydrocortisone suspension, methylprednisolone. Types of parental routes of administration. First, intravenous injection. The injection of a drug is directly into the patient vein, resulting the most rapid onset action, administered at a 15 degree to 25 degree angle. Second, Subcutaneous injection. The injection of a drug under the skin into the fatty layer but not into the muscle, given at a 45-degree angle. No more than 1.5 ml should be injected into the site. Third, intradermal injection. The drug is injected into the top few layer of the skin. Ideally, the drug is placed within the dermis. The angle of administration of intradermal injection is 5 degree to 15 degree angle. The amount of a drug given is small and absorption is slow. Fourth, intramuscular injection is an injection technique that used to deliver the medication into the muscle to allow the rapid absorption into bloodstream. Administered at a 90-degree angle, no more than 3 ml volume should be injected. Fifth, intra-articular injection. Intra-articular route involves the injection into the joint cavity, used for lubricating the joints. Corticosteroids may be injected by this route in acute arthritis. Sixth, intrathecal administration is the route of administration for the drug via the injection into the spinal canal or into the subarachnoid space, so that it can be reached the cerebrospinal fluid. The route is useful in the spinal anesthesia or pain management application. Seventh, intracardiac injection. These are given into the heart muscle or ventricles at the time of emergency only. Next, intraarterial. The injections are given directly into the artery. This method is used for chemotherapy in case of malignant tumor. Ninth, intraosseous infusion. Intraosseous infusion is the process of injecting medication, fluids or blood products directly into the marrow of the bone. 10th, intraperitoneal injection. The peritoneal possesses a cavity offers the large absorption area for the drugs. This route is used in laboratory animal administrations and the large animal practice for the administration of large volume fluid. Formulation of parenteral preparations differ from therapeutic agent, adjuvant and vehicles. First we see the therapeutic agents. In that, active pharmaceutical ingredient is a pharmaceutical drug that biologically active in order to treat the disease. Example, paracetamol is the active pharmaceutical ingredient for crocin and it gives relief from body ache and fever. Adjuvant. Adjuvants are added to provide the safety in parenteral preparations. They must be non-toxic and should not be interfere with the therapeutic efficacy. Buffers. Buffers include in injection to maintain the pH of packed product. pH change can arise through interaction between product and container. Example, citric acid and sodium citrate. Antibacterial agents. Antibacterial agents added to multiple dose injection to prevent the microbial growth. Example, phenol, cresol and benzyl alcohol. Antioxidant. Antioxidants are used to parenteral formulation to slow down or inhibit the oxidative degradation of therapeutic agent. Example, sodium metabisulfate, sodium thiosulfate. Emulsifying and suspending agent. Suspending agents are useful for stabilizing the suspension, where the emulsifying agents are useful for stabilizing the emulsions. Example, suspending agents are methyl cellulose, gelatin. Emulsifying agents, lecithin, polysorbate 18. Solubilizing agents, they are used to increase the solubility of drug which are slightly soluble in water. Example, ethyl alcohol, glycerin. Tonicity adjusting agent, aqueous solution having the same osmotic pressure as that the blood plasma are called isotonic with plasma. Solution are not isotonic may cause the adverse effect. Example, sodium chloride and dextrose. Vehicles. Vehicle is a non-toxic, non-therapeutic component of injection. It is generally present in the highest proportion in the injection. There are two types, aqueous vehicle and non-aqueous vehicle. In aqueous vehicle, water is used which is well tolerated by the body. It is non-therapeutic and non-toxic. Water for injection is the water specially prepared, collected and stored in the way that is sterile, free from pyrogens and particulate matter, and it must be clear, colorless and odorless. Example, water for injection, sodium chloride injection. In non-aqueous vehicles, oil are used as a vehicle. Drug that is insoluble in aqueous system are incorporated in oil which are easily metabolized. Oily injections are only administered by the intramuscular route. Some patients may exhibit the allergic reaction to certain vegetable oils. Oil, oil like peanut oil, sesame oil, olive oil, cottonseed oil. Example, dimercaprol injection. Then in that arachis oil is used as vehicle. Advantages of parental route. The IV route is the fastest route for delivering the systemic drugs. Rapid onset action, useful for emergency situation. Can inject the drug directly into the tissue, that called targeted drug delivery. Useful for delivering fluid, electrolytes or nutrients. Infusion rate can be adjusted. Useful for patient who cannot take drug orally, and viability is 100%. Disadvantage of parental route. Traumatic injury from the insertion of needle, sensitivity or allergic reaction at the site of injection. Trained person required. Difficult to reverse and administer drug effect. Required specialized equipment, device and techniques to prepare and administer the drugs. More expensive and costly to produce. Evaluation of parenteral preparations. The finished parenteral products are subjected to the following tests in order to maintain the quality control. First is sterility test, in that membrane filtration and direct inoculation. Second is a leakage test. Third is a pyrogen test, in that rabbit method and lal test. And fourth is a clarity test. First we see the sterility test. It is done by detecting the presence of viable forms of bacteria, fungi and yeast in parenteral preparations. The test is done under the aseptic condition in order to avoid the accidental contamination of the product during the test. Glasswares are used for the test must be sterile. The test of sterility may be carried out either by membrane filtration method. The pore size of membrane filter is not greater than 0.45 micrometer. Then the test solution is filtered through the membrane under the aseptic condition. Membrane filter is cut into two equal halves. One half is immersed in 100 ml of soybean casein digestive medium for fungi, which can be incubated at 20 to 25 degrees Celsius, not less than 7 days. And one half is immersed in 100 ml of fluid thioglycolate medium for bacteria, which can be incubated at 30 to 35 degrees Celsius, not less than 7 days. Then observe the growth of media. If after putting thioglycolate medium or soybean casein digestive medium, it produces turbidity. Turbidity appears because the viable microorganisms are present after entering the medium. It starts the multiplying and it indicates the preparation is not sterile. Direct incubation method. The quantity of the test substance in each culture media is directly transferred under the aseptic condition. The medium is incubated, soybean casein digestive medium at 20 to 25 degrees Celsius and fluid thioglycolate medium at 30 to 35 degrees Celsius for 14 days. Observation and result. Culture media is examined during and after at the end of incubation. First, if there is evidence of growth, then preserve retest is performed. The same number of sample, volume and media as the original test. Then also evidence of growth. We isolate and identify the organism, same as in preserve test fail. If the evidence of microbial growth product does not comprise the test of sterility. Second, if no evidence of microbial growth product compiles the test of sterility. Leakage test. The seal ampoules are subjected to the small cracks which occur due to the rapid temperature changes or due to the mechanical shocks. Filled and seal ampoules are dipped in 1% of methylene blue solution under the negative pressure in vacuum chamber. Vacuum is released, color solution enter in the ampoules. Defective sealing. If color is change occur, leakage is present. If color change does not occur, leakage is absent. Vials and bottles are not suitable for this test because the sealing material which used is not rigid. Pyrogen test. Pyrogens are fever producing metabolic product of microorganisms. Pyrogen can cause fever, platelet aggregation and alteration in blood coagulation that produce shock or even death. So determination and elimination is important in parenterals. A rabbit test. Adult, either sex, weight not less than 1.5 kg rabbit is selected. Test is carried out of the 3 groups of rabbit. Then test procedure. Dissolve the test substance or dilute it with the pyrogen-free saline. Warm the solution to the 38.5 degree before the injection. Then insert the clinical thermometer into the rectum of each rabbit. Record the temperature of 2 times of 30 minutes interval. Then mean is calculated as the initial temperature. Solution is injected into ear vein of each rabbit not less than 0.5 ml per kg and not more than 10 ml per kg. Then record the temperature of each rabbit at a 30 minutes of interval for 3 hours. Result: if response of all rabbit is less than 0.6 degrees Celsius and some response of 3 rabbits is not more than 1.4 degrees Celsius, then preparation is pass the test. If not passed, then same test is repeated at another set of 5 rabbits. If not more than 3 out of 8 rabbits shows individual response of 0.6 degrees Celsius or more, if sum of response of rabbit is not more than 3.7 degrees Celsius, then preparation is pass the test. Lal test is a limulus amoebocyte lysate. The test is based on the formation of gel or development of color in presence of bacterial endotoxins and the lysate solution. There are 3 types of Lal test. First is gel clot test, second turbidimetric test, third is a kinetic chromogenic test. First, gel clot test. The lysate solution is mixed with an equal volume of test solution in pyrogen-free test tube. Then allowed to stand for 60 minutes. Tube is inverted and observe the formation of gel clot. If the solid gel is not formed, that indicates the absence of endotoxin. Hence, solution is passed the test. Second, turbidimetric test. Test is based on the measurement of opacity change in Lal test. Due to the formation of gel clot, the opacity is directly proportional to the endotoxin concentration. Third, kinetic chromogenic test. This is based on the measurement of color change due to the release of chromogenic chemical, that is p-nitroanilide, which is byproduct of clotting reaction during the Lal test. The quantity of p-nitroanilide produced directly proportional to the endotoxin concentration. Reference: we are thankful to our President Honorable Dr. Shivajirao S. Jondhle, Secretary Honorable Dr. Geeta Khare Ma'am, and our Principal Dr. Nitin Moire sir for encouragement and guidance for effective use of social media to spread the knowledge through making informative videos. For such new videos, please like, share and subscribe our channel. Thank you.